Hello ladies and gentlemen, and welcome to my talk. It's the 20th of August 2022. Pharma profits are bad for our health. Today I want to talk about the negative impacts that Big Pharma has had on psychiatry, our soil, our food, our health, our education, and even our government. When you consider that the separate fields of psychiatry, the earth or our soil, our food, our health, our education, and who governs us just about makes up the entire living experience as human beings, it seems as though Big Pharma has a complete monopoly on the human experience. I'm sure that you will agree that if that is the case, we should investigate whether this situation is positive or negative for human flourishing. Because after all, if as humans we cannot have the opportunity to flourish, we'll never realise our true meaning and purpose. And it's been meaning and purpose that's becoming increasingly elusive in the last 40 or 50 years. You know, it's very interesting that in August 2021, the FDA approved the first COVID-19 vaccine by Pfizer. Yet it was 2 years earlier, in November 2019, that Dr. James Davies was delivering a lecture exposing massive doubt about Big Pharma in the psychiatry world. And I'll put a link to that lecture in the comments below, and I encourage you to watch it. It's perhaps one of the most eye-opening lectures I've ever seen. Briefly though, he discusses how mental disorders were first introduced into a technical manual known as the DSM, or Diagnostic and Statistical Manual. Basically, it involves 9 professionals, mostly from the same university, sitting around and categorising unusual behaviour in the 1950s. And originally they categorised 102 mental disorders in the DSM in the edition 1. However, the number of disorders has increased to around 370 today. Now, during his research, Davies went and interviewed many of the people originally involved in those meetings, and he was astonished to find that the categorization process didn't involve any science whatsoever. The book DSM is the absolute Bible for psychiatrists, so much so that this book has featured many times as one of the world's most sold books. Retailing it up to $300 US a copy, this is astonishing. I mean, it outsold 50 Shades of Grey in the US. How is that even possible? There are only about 386,000 practicing psychiatrists in the entire world, yet this book has sold more than 2.4 million copies. And the question needs to be asked, if there's no science involved in the categorization process of the disorders, how can it be possible that this book has sold in the numbers that are many times more than the entire world's population of psychiatrists? From Davies' own research, it appears that the purchases are mostly in bulk orders by one entity, who then distributes them freely to any entity that can prescribe drugs. Does that give you a clue who it might be? Let's just park that for a moment and talk about what big pharma companies did with this book. And just think about this for a moment. If you were a big drug producing company and there would just happen to be a book listing 370 different mental disorders, do you think that you might try to make drugs that supposedly fix the most common of those disorders? After all, the disorders appear to be largely made up. Davies, and along with a number of others, assert that's exactly what they did. For instance, they paid scientists to write papers showing that a lack of serotonin causes depression, whereas being depressed is actually a normal human experience. They developed drugs such as Prozac, which contain serotonin. And because there were scientific papers proving that depression was caused by a lack of serotonin, they sold them internationally in numbers that would make your mind boggle. I'm talking about 1 in 10 Americans currently use these drugs. So without any investigation into the cause of depression, such as a lack of vitamin D, poor nutrition, sedentary lifestyle, apparently, according to Eli Lilly and Company, a big pharma company, they could develop a simple pill that could fix the problem. Easy, isn't it? Well, it just so happens it's not that easy. Patients started to develop Prozac serotonin syndrome, which involves the Prozac taker suffering from agitation, hallucination, coordination issues, racing heart, fever, nausea, vomiting, diarrhea, and many other issues besides. As a result of this sleight of hand, pharmaceutical companies have become extremely wealthy and so extremely powerful too. With this big money and big power, they could simply pay more and more scientists to write more and more papers showing that a plethora of drugs could solve a plethora of disorders. On it went, fake pills for fake disorders and not a bit of real science involved. Even though Davies was exposing this in 2019 and earlier, just recently science has caught up. Science now shows us that there is no link between serotonin levels and depression at all. And like Davies, I believe that science will eventually show that almost all of these fake drugs do not work on these mostly fake disorders. And that before any drugs are prescribed, lifestyle, diet and stress levels should be investigated, because we know lifestyle, diet and lower stress levels will improve our mental and physical health. I mentioned diet as a possible intervention to poor mental health. And obviously diet is the most important thing of all if we want to live healthy and productive lives. And considering the importance of good and plentiful food to every single human being alive, it shouldn't be a surprise to you that these huge, unscrupulous chemical companies with huge wealth and power are donkey deep in trying to enrich themselves further in this industry too. Which is strange, because up until their appearance, food used to grow just fine. The drug companies got involved in trying to mass produce food, and the biggest thing stopping mass plant-based food production was the availability of suitable nutrient-rich soil. And to solve these issues, the chemical companies developed pesticides and herbicides that would allow them to grow food without the nutrient-rich soils. And they protected the chemically altered plants from pests by spraying them with these pesticides and herbicides. They achieved their goal of mass food production, and the supermarkets are now full of these artificially grown plant-based foods. Not only that, the chemical companies contributed to the manufacture of highly processed foods as well. You know, the sort of stuff that comes in boxes and that you don't recognize as whole foods sitting on your plate. Wonderful, right? Well, it appears not. The trouble is that the unscrupulous pharmaceutical companies didn't conduct tests to see if there was a downside, or rather, as they'd done with the psychiatric drugs, they failed to publish the downsides. And the downsides include that glyphosate, the weed killer, is highly toxic and can build up in the body, causing cancer. And Monsanto have already paid out millions in lawsuits. It also kills the microbiome in the soil, turning it into lifeless dirt. Another downside is that to kill off the pests, they spray the food with pesticides. Yet it is the action of the pests on the plants that allow the plants to produce more of the nutrients that we need as humans. Okay, they don't look quite as good, but they contain more of the nutrients that we need. So Big Pharma has destroyed the microbiome in once fertile soils in huge areas of once arable land, and they've also reduced the nutritional benefits of many of our plant-based foods. Without a healthy microbiome in the soils our food is grown in, we humans don't have a healthy gut microbiome. And that is a much bigger problem than you might expect. Life expectancy has been declining in the US since 2014. Worse, the highly processed foods sold in these supermarkets and fast food stores contain enhancers, mostly sugar-based. And this is done to get people hooked on them. And as a result, diabetes, obesity and heart disease are endemic in most Western countries, with heart disease the leading cause of death. We're talking about hundreds of millions of productive and happy years of life by actual living human beings gone, not to mention the miserable years of sickness endured before the death occurs, of course. And when you consider that they've done this over a number of decades and people have almost stopped growing their own food, I think it's time that we started to grow our own vegetables again without glyphosate and pesticides. How else have these big pharma companies affected us? Well, does anybody remember the 1976 swine flu fraud reported by the 60 Minutes program? How about thalidomide, a pharmaceutical drug used widely in the 1950s and 60s for the treatment of nausea in pregnant women? Up to 10,000 miscarriages, 80,000 people killed, and 100,000 birth defects were caused by these companies. Do you remember that? Then there's the 10 worst drug recalls in history, in which hundreds of billions of dollars have been paid out to families whose loved ones have been killed or maimed. And I'm not going to try and read the medical names, I'll do the abbreviated versions. There's DES, there's Fen, there's Celdane, there's Posicor, Resulin, PPA, Baycol, Vioxx, Bextra. And finally, in terms of the damage Big Pharma has done to our world and to our lives, we're only just coming to grips with the crippling loss of life, loss of jobs, and human suffering the latest pandemic has caused. It appears that despite the vaccine, which Pfizer states will not prevent anyone from catching the disease or from spreading it, most people caught the virus or one of a number of others currently going around in numbers that we've never seen before. Supply chains disrupted, businesses closing, collapsing economies. Along with those who got sick with the virus, me included, there were many others who had bad reactions to the vaccine. Serious problems occurred such as myocarditis, pericarditis, Guillain-Barré syndrome, anaphylaxis, antibody-dependent enhancements, and even death. Thankfully, we're told that these afflictions were rare. And I guess that would be true. But just let me give you my own experience for people reasonably close to me. Firstly, colleagues, there was one of them that was rushed to hospital after vaccination with racing heart, suspected heart attack he had. And he was told that it was anxiety and he would go away. He was in his 40s. There's two others who have gone to doctors with a racing heart, and they've been told that it was anxiety and they were given pharmaceutical pills. One was in his 30s, one was in his 40s. There was four others that were close to me that had days off, feeling lousy after the injections, and all of them were under 40. And of friends, there was one that died. I got a text from him in hospital. He was in Christchurch. He gave a photo with needles in his arm and a smiling face, and he said he had a racing heart after the booster. Finally, he was let out, and within 2 weeks, he was found dead of a heart attack. And he had no history of heart issues, and there wasn't an autopsy done. He was in his 60s. My daughter-in-law, immediately after the first vaccine, had a sagging face, massive headaches, and was rushed to hospital with Guillain-Barré syndrome and an anaphylactic reaction. She's a nurse and has since come down with a continual stream of allergic reactions in her upper respiratory system. She's in her 30s. My sister had an anaphylactic reaction after the vaccine, and she's terrified that they'll make her go and have another. She's in her 50s. It's clear that while some drugs are good for us, many drugs do not improve our mental health. They actually make things immeasurably worse. The drugs have killed the microbiome in our soils, which has negatively affected our gut health. Autoimmune diseases are at an all-time high. Human health in the West is declining. Our food has become toxic, and post the mass vaccine campaign, COVID and other illnesses are in the community at higher levels than ever before. While I'm sure there are benefits to Big Pharma, personally, I've decided to follow the terrain theory. That is to try to eat only organic whole foods. Fasting for at least 14 hours per day, getting plenty of vitamin D, and at least 30 minutes of exercise outside every day. I've been doing this for about 8 months now, and I have the first time for a very long time I have the correct BMI, and I feel really great. I don't get sick. In fact, I hardly ever get sick. So I don't need pills and injections. The terrain theory is opposed to the germ theory, which states that humans will likely all get sick as a result of germs, and that when you do, there are pills and injections developed by experts to fix you. In other words, there's no need to work hard to maintain a healthy terrain. They have cures for everything. Just tell me how that's working out for us individuals. Thank you for listening to my talk today. I've been Andy Oakley.